USMLE style question, nursemaid's elbow. A 4-year-old child is brought to the emergency department after being pulled suddenly by the arm while playing. The child is crying and refusing to move the affected arm, holding it in a slightly flexed and pronated position. On examination, there is tenderness over the radial head, but no obvious deformity or swelling. The child is unable to fully extend the arm. Which of the following is the most likely diagnosis? A. Supracondylar fracture. B. Nursemaid's elbow, radial head subluxation. C. Clavicle fracture. D. Humeral shaft fracture. E. Rotator cuff tear. Answer and explanation. B. Nursemaid's elbow, radial head subluxation. Nursemaid's elbow is a common injury in young children, typically occurring due to a sudden pull on the arm, e.g., being yanked by the arm or swung by the hand. In this injury, the radial head slips out from under the immature annular ligament, causing subluxation of the radial head. The child presents with refusal to move the arm held in flexion and pronation, tenderness over the radial head, no significant swelling or deformity. The injury commonly resolves with reduction of the radial head, e.g., by supinating the forearm and flexing the elbow. Why not the others? A. Supracondylar fracture affects distal humerus, causing pain, swelling, and deformity, especially in the elbow region. The child would have severe pain and would be unable to move the elbow, unlike in nursemaid's elbow, where motion is limited, but the child does not have a deformity. C. Clavicle fracture would cause pain over the clavicle with swelling and a noticeable deformity, e.g., a bump on the collarbone. The arm is usually held in an adducted position, not flexed. D. Humeral shaft fracture would cause significant pain and swelling along the humerus, often with deformity. The child would be unable to move the entire arm, and there would be palpable bony tenderness. E. Rotator cuff tear, uncommon in children. This would present with shoulder weakness, pain, and difficulty with overhead motion, but it would not present in the context of acute trauma or refusal to move the arm. Key USMLE takeaway. Nursemaid's elbow equals radial head subluxation due to sudden pull on the arm in young children, arm held in flexion and pronation.